and welcome to the Legal Edition. I'm your host, Attorney Mary Kay Elloian. Our show topic today is part 2 in our series, Toxic Teeth, Toxic Truth, Mercury, Amalgams, and the FDA. We will be talking in this segment about whole body health and whole body dentistry. Our guest is Dr. Mark Breiner. He is author of the award-winning book, Whole Body Dentistry. He has written about classifications of hazardous waste and everything in the human body and how to get well. Let's welcome Dr. Breiner. Welcome again, Dr. Breiner.
Hello, thank you for having me.
Okay, from what I have discovered doing some of my research and also in reading your book, the American Dental Association tells us that if we have amalgams in our teeth, we should leave them alone. We should, live our life and not be concerned. What are your feelings on that?
Yes, they say that you should not remove suitable amalgam filling for health reasons. Matter of fact, they say it's unethical. I spent 7 years battling the state of Connecticut trying to take away my license because they said that what I was doing was unethical. And you're not allowed to remove fillings for health reasons. It's interesting, if you come and say, these fillings are black and dark, I don't like them, can you remove them for aesthetic reasons? That's perfectly ethical. But if a patient, wants to remove them for health reasons, the dentist could be in trouble. Really? Yeah. So again, something that doesn't make any sense.
It's unbelievable. From my reading in your book, I learned about electrical problems, which I'd never heard of before. What are electrical problems in the mouth?
Well, because the fillings are half mercury and the other half are copper, tin, zinc, and silver, when you put dissimilar metals into a salt solution like saliva, you create a battery. Oh. And it's called a galvanic battery. Galvanic current runs. Matter of fact, you're taught that you should not put a mercury filling in the same mouth as a gold filling.
Really?
Because there's a very strong attraction between gold and mercury. They use mercury to extract gold. So, and they teach you that in school. Of course, when you go down to the clinic floor, they say, well, forget about that. Don't worry about it. But the problem is these fillings actually can generate a lot of current. Now, that becomes a problem for a couple of reasons. One is you're only this far away from your brain.
Right.
So you can interfere with your brain functioning. And the other thing is that every tooth is on an acupuncture meridian. Every tooth relates to certain organs and tissues and vertebrae. And so I found that when you have high electrical current, you can interfere with the energy flow along the meridian and cause problems from that respect.
In a remote location of the body.
Absolutely.
Whether it be an organ or even cardiovascular, I would assume.
Right. So this energetic connection is really fascinating, both from the electrical aspect and from the acupunctural aspect. And it's very important to be aware of this, and we're not taught this in dental school. Like, for instance, I had one patient, she came to me because she had a root canal on a front tooth that had been bothering her, and she wanted to know what to do. I hadn't seen her in a number of years, and she came in for my opinion because she lived out of the state. And in saying, well, what's going on with you? Turns out she had very severe pain in her tailbone, her coccyx bone, and they couldn't figure out what was going on. And what's interesting is she's having this trouble on a tooth that acupuncturally related to that pain. So she elected to extract that root canal tooth, and that got rid of her tailbone pain.
That's unbelievable. It's like you're a detective in someone's mouth. It's unbelievable what you can find on that meridian. What are some other situations you have seen with regards to whether it be cavitations or root canal or any of these other issues?
There are a lot of things in the mouth besides fillings themselves that can cause trouble. You mentioned cavitation, and a cavitation is a hole, it's a cavity, and in the bone. And you can have it in any bone in the body, but in the mouth we especially see it in areas where wisdom teeth have been extracted. Now these cavitations, you can't see it. The tissue heals over and looks normal. Sometimes you can see on an x-ray if you know what you're looking for, but very often these are hidden. And they're like cesspools. They attract mercury. They found that there's a higher concentration of mercury in these. Bacteria, viruses. So a lot of people, these can cause problems. And I myself experienced this in that I had my wisdom teeth out when I was in dental school. And then about 30 years later, I started developing a heart arrhythmia. And I took some homeopathics. I did intravenous magnesium, and nothing helped. And then all of a sudden it dawned on me, I said, wait a minute, I better check my wisdom tooth area, because the wisdom teeth are on the heart meridian. And sure enough, there's a way that I do energetic testing, found that there was a problem on that meridian. Wow. So I went in and had a friend of mine, oral surgeon, I said, please clean this out. And he said, there's nothing there. I don't see anything. I'm not doing it. I said, no. He opened it up and he was shocked because I had the size of my pinky. There was a hole in the bone.
Wow.
And once we cleaned that out and got it to heal, that's been fine for over 20 years now.
Now, there's different types of energy testing, I believe. There's something called EAV testing, and there's kinesiology. I don't know if they're one of the same. Can you explain that?
Well, they're the same in that they're testing energetically. EAV stands for electroacupuncture, according to Voll. Mm-hmm. And Dr. Voll was a German physician. He started around 1950. He was a practicing physician. He was a homeopath. He was an acupuncturist. And he was an anatomy professor. So he took all his loves mm-hmm. and kind of combined them. And he came up with an instrument where we can test on acupuncture meridians on the hands and the feet and get an idea what's going on in the whole body. And
you've had good results with that?
I've been using that for, I guess about 30 years now. And I'd rather my handpiece be taken away than that instrumentation.
Really?
Because that gives me an insight as to the effects that teeth can be having on the body, or that the body can be having on the teeth, like that person I mentioned with the tailbone pain.
Right, right. So it can be vice versa.
Teeth, it's a two-way street. And so teeth can affect the organs and tissues, but the organs and tissues can affect the teeth. So this testing allows me also, from this testing, I get an idea of how toxic a person is, how toxic they are with heavy metals. And it's never just mercury, it's heavy metals in general. Uh-huh. You'll have copper and tin and aluminum and lead and all sorts of things.
You can tell all that?
You can tell all that. Viruses and pesticides and chemicals and all sorts of things. So you can get an idea of the kind of toxic load on a person.
Is it accurate?
And, I find it extremely accurate. It's not an accepted, way of checking a patient, but
by the ADA?
By the ADA or the FDA, by anybody really. Mm-hmm. It's, they don't believe in the energetic aspects of things. Mm-hmm. It's enough that they finally agree that there's such things as acupuncture meridians. But it's just a wonderful way mm-hmm. to find out what's going on. And one thing that I find it extremely important with, somebody wants to get their fillings out. Don't go out, don't run out and get your fillings out. You can end up in trouble. There's something called the mesenchyme. And the mesenchyme is kind of the tissue surrounds every cell of your body. If you picture a tile floor, if the tiles are the cells, the grout is the mesenchyme. And the mesenchyme is actually where your nerve endings, your venules, your capillaries, mm-hmm. your lymphatics all end in that. Mm-hmm. If that mesenchyme is blocked, and that's where exchange of everything takes place, that's where as your cell gives up carbon dioxide, it goes into the mesenchyme, it's picked up and taken out, and oxygen comes in, unloads into the mesenchyme, diffuses into the cells. If that's blocked, number one, it means the person's very toxic. If you start taking fillings out, those are the cases where people get extremely ill from removing mercury fillings. And it is an extreme case, but there's one that always stands out in my mind. A woman went out to California who was about 60 years old, and she was pretty healthy, but she wanted to be in optimum health. Mm-hmm. And as she was getting older, she wanted to ensure she was going to be healthy. And she went to some clinic, and they said, you really need to get your mercury fillings out. And she had them all taken out, and in 5 days she was walking with a cane. In a couple of weeks she was in a wheelchair.
Oh my God.
And unfortunately, you know, I see this not to this extreme, but people coming in that have had fillings out in an hour weren't sick and now they're sick, or they're sicker. So unfortunately, like this woman, I sent her to a physician who specializes in mercury toxicity and all, and there was nothing to do for her, and she passed away. So, like I say, it's a very extreme example,
Right.
but nonetheless, it points out that you do have to be careful taking these fillings out. There are things that need to be done before. There are precautions that have to be done during, and then after.
And what are some of those precautions that you utilize that are the correct way of removing these amalgams?
Well, one is checking the mesenchyme. If the mesenchyme is blocked, and I find the EAV very, very beneficial with that, I will not take a filling out. And then it's a matter during, while we're taking the fillings out, we want to protect the patient. We're going to use what's called a rubber dam that isolates the teeth so you don't have the fillings going down the throat. We're going to sprinkle a powder all around and under the dam that helps bind mercury. We're going to have the patient breathing oxygen. We're going to use suction, actually surrounds the tooth. And then we have an auxiliary suction, like a big vacuum cleaner, that we have to pull out the mercury vapors, and we have filters going on in the room. And the other thing was, besides the fact before that the mesenchyme wasn't blocked, I'll use homeopathics to help support the liver and the kidneys and the mitochondria inside the cell. And then we take those fillings out very carefully. We use a lot of water. I section the fillings. We don't grind them out. Because remember I said, anytime you touch these fillings, you're going to get more mercury coming off. So we want to decrease as much as we can.
Minimize.
I myself wear a special miner's mask, so does my assistant, so we're not breathing in those vapors. We get the fillings out, and we replace them usually with a composite material. And then after, it becomes very important now to get the heavy metals out of the system.
And how do you do
even
that?
I find a lot of people, they'll go have their fillings out, and that's never addressed.
Right. And how is that done?
Well, there are various ways to do that. Some physicians might use intravenous treatment where they're using something called DMPS, or they may use glutathione drips. You could take supplements like glutathione and high sulfur type of supplements, methionine, because remember, mercury loves sulfur, so you use that. Eating eggs, the sulfur in the eggs helps. I find, for me, in my patients, and for decades now, I've been using combination homeopathics. The same ones that I used before to support the liver and the kidney and all, I then add in a homeopathic that helps get the heavy metals to exit from the system.
So it sounds like there's a protocol before someone should even embark upon the idea or the notion of removing the amalgams. And there's also precautions that you're taking during the actual procedure. And it sounds like there's actual after therapy, things that need to be done to get the body back into a point of homeostasis.
Right. The body loves to go into homeostasis. It likes to heal itself. So I look at what we're trying to do is just remove those impediments.
Exactly. So the mercury has been one of the impediments. And from what I understand, too, root canals can be very, very toxic, but a lot of people don't know about that.
That's another thing. Yes, root canals. You know, a root canal is where, let's say inside the tooth, you have a pipe, and in that pipe is the nerve and the blood supply and the lymphatic supply. And that pipe, if that dies, you now have a dead tooth, and very often you can end up with a toothache or an abscessed tooth. So in a root canal, they go and clean that pipe out, and then it gets sealed. And traditionally what you're taught is if the tooth no longer hurts, and on an x-ray everything looks fine, then everything's good. The problem is that isn't always the case. Because it's a dead tooth, it's gangrenous, and that tooth gives off toxins. And those toxins have been shown to be more potent than botulinum.
Really?
A man named Dr. Weston Price, who in his day actually had been head of the American Dental Association at that time, did 25 years of research on root canals. And I have all his volumes of work. It was incredible. He was an impeccable researcher. And he showed that all the things that a root canal can cause, which can go from anything from mental problems to arthritis to heart disease, anything, because those toxins, depending on where your weak area is, they will go to that area. He found that 25% of the people were able to tolerate a root canal. So I don't look at it that every root canal has to come out. It depends on your immune system and are you able to quarantine those toxins. Mm-hmm. If you can quarantine the toxins, you could be all right. Mm-hmm. The problem is you need to be able to get an idea on if you are quarantining them. Mm-hmm. And that's where, again, I find the EAV testing to be mm-hmm. very important, because I can get an idea if that's happening.
Wow, that's fascinating. What about also the dissimilar metals issue, again, with braces? A lot of children are getting braces. Is that a problem with amalgams or with any other surfaces?
It's a problem in and of itself.
Really?
I know, so you have pierced earrings. You know, a certain amount of women, like 10% of women, react if they don't use gold. If they have any nickel in the earring, their ears will break out and itch. And you're going to have when the regular braces, the metal braces, are nickel-based, and so are a lot of the wires. So a child can be reacting to those braces, can affect their immune system and turn it off. And again, the problem is if you're not aware, you don't see this. Now this I became very aware of because this happened with my son. And my son always had ear infections when he was younger. We got by that using homeopathy. But then when he was about, I don't remember now, maybe he was 10, 12 years old, I had the orthodontist put 2 orthodontic brackets on his molars. He immediately came down with an ear infection.
Really?
And I said, geez, that's really strange, you know. So I immediately had the brackets taken off. He got better. Then I said, you know what? This is in my head. All right? So I had the brackets put back on. He now came down with pneumonia.
Oh, my goodness.
And I had a blood sample sent out to the University of Colorado to a person who's doing research in this area. And he came back and said, you turned off your son's immune system. He's the most sensitive to nickel to this date that I've ever seen.
Wow.
So if I hadn't been aware of that, who knows what would have happened, because I've seen kids have quote, leukemia, because they've either had braces or these stainless steel crowns that are nickel-based that they put in, the pedodontists like to use on kids. So a certain amount of children will react. And if you're not aware of this, you could have some pretty bad consequences.
I even heard that even with the gold, sometimes it can be other things mixed in, so it's not pure gold, and then that can be reactive as well.
Yeah, it's never pure gold.
Because
if I do for some reason have to use gold, I use just gold and platinum. But a lot of times today they'll mix in palladium, which I find not too good. There'll be copper in there. There can be a lot of things, and you can generate a lot of current. Mm-hmm. I find a gold platinum to be very low in current. Mm-hmm. But you do have corrosion. You do have gold then going off into the system. This also, the corrosion happens even with titanium. Now, you know, we talk about today, you have implants are big.
Right.
And that can you can have 2 problems with a titanium implant. One is you're going in on an acupuncture meridian, so you don't know all the implications of what's going to happen there. And the other thing is you do have titanium coming off and going to all your cells. So today, if a person has an implant, I like for them to have a ceramic implant. So at least you don't have the corrosion aspect of it. You still don't know totally what's going to happen going in on the meridian, but at least you don't have the corrosion problem.
It's amazing. Dentistry today, according to your research and your work, is just so specific. It's not what traditional dentistry was all about.
No, it's not your typical drill, fill, and bill.
Exactly.
But in a way, it's much harder because in the sense when you know all these things, you have to keep all these things in mind, and you have to educate the patient so they can make an informed decision as to what they want to do in their mouth. I don't tell anybody don't do this or do that. We give them their options and let them make an informed decision.
And that's the key, having an informed decision.
Right.
With the amalgams and with some of the traditional, like we talked about in our first segment, about DSS and even the military, many times it's mandated that they have to have amalgam, and that can be a problem. I think, ethically, I think it is quite a problem. What about some of the detoxification protocols that you have? What do you do for a patient that's ill?
Well, I'm going to use the EAV to assess. And like I say, and the way I do it, I mean, I also go and prioritize. I have a way, so when we're doing this, let's say a person, we find that they have a lot of pesticides and chemicals and heavy metals, or fungus and mold, we can prioritize. We actually inquire of the body, what is it you would like to remove first? And I find if we go and remove things in the order that the body wants to get rid of them, it's a smoother ride for the patient. We have a better outcome. So really about 70–80% of the time, it's not heavy metals the body wants to get rid of first.
What is usually the first priority?
Pesticides or chemicals.
Really?
And you know, a lot of people have Candida, and they are on a strict Candida diet, and they have to be very, very careful, and they say, I just can't get rid of this. And I find that's usually because they have a heavy metal problem.
Really?
And so usually parasites and Candida, I found, won't respond to treatment until the other toxins are removed.
That's amazing. I know the treatment protocol is usually probiotics to help that person rebuild the flora in their intestinal tract. But it sounds like there's other issues that go along with that Candida, and the heavy metal is one of them. So in other words, no matter how many probiotics you take, if you still have that heavy mercury or toxic load, you still can't get rid of Candida.
I don't find it happens.
Wow, and EAV can tell you all this.
EAV, right, I find.
It's amazing.
And let me stress one thing, though, that all of this I'm doing is so a person can have a healthier mouth, okay? Because you can't have a healthy body and a sick mouth, and vice versa.
Right.
They go hand in hand. The mouth is just a reflection of what goes on in the body.
And from what I understand, too, you use a microscope in your practice. Can you tell us about that?
Well, yeah, I mean, another problem, some people have periodontal disease. And so one of the things we do is we go in and just go under the gum slightly and get a plaque sample. That's that kind of sticky substance you might feel on your teeth. And we put that under a microscope. And we look at it because a lot of times we'll find a person has an infection there. And their gums may even look pretty good, but they're loaded with spirochetes, parasites. And so if that's the case, we want to work on getting the person healthier again and getting a change in that slide. So because either they have periodontal disease or they're very at risk for periodontal disease. And also they found like the spirochetes that are in your gums will be in your heart tissue.
Oh.
Okay, and be in your arteries, because a lot of these things, like heart disease, is a problem of inflammation. So periodontal disease is inflammation. All these toxins are inflammatory. So as you address all these things, you are setting a person up to be healthier.
And they can recover, from what I understand. Now, from what I understand, there's an organization called the IAOMT. Can you tell us
the
about them?
International Academy of Oral Medicine and Toxicology.
And they promote all of these protocols?
No.
No, they don't.
But they do have a accreditation process, so a person goes through that to know how to safely remove mercury fillings.
I see.
And they do fund research, and they do raise the level of awareness of dentists. So it's a very important organization.
Yeah, and another aside, there's a woman, her name is Freya Costes. I had spoken with her. She had actually contacted me, and she had a situation where she developed MS from a mercury amalgam, and then I believe she sued, she brought legal action against the maker of the amalgam, and she was successful because she had been poisoned by this amalgam. I think, if I recall, the IAOMT is involved in some of this litigation.
It's involved with litigation against the FDA and trying to get things changed. And there's also what's called the Minamata Convention, where 120 countries, including the United States, have signed on to decrease the amount of mercury usage in general. And most of the countries agree should be reduced in dentistry, or gotten rid of, actually.
Right. I know Ms. Costes, she's been active in Pennsylvania, where she resides, and she's gotten the law changed for informed consent so that people actually know that there are other materials that are bioavailable through her sacrifice. But she is now totally well now because she's had protocols similar to what you've been describing to make her well from that toxic episode she had in New York somewhere.
Right, and that's you know, it's great. She won the suit. I mean, most people have sued, they've been thrown out and have not been successful. She was one of the very few.
Yeah. So she proved that there was an injury and it was amalgam related. So hopefully that'll, you know, help open some doors for some more eyes to look for the FDA and the EPA to make these changes, because they need to be made so people can get healthy.
Right.
And again, your book is the Whole Body Dentistry. It's a award-winning book. I couldn't put it down. It was excellent. I want to thank you for writing such a book so that you can enlighten people like myself and the public to make wise decisions.
Thank you.
Thank you for joining us. I want to thank our guest, Dr. Mark Breiner, for sharing his research, his experience, his insights on mercury amalgams and getting healthy. For more information on today's topic and our guests, please visit the Legal Edition online at thelegaledition.com. And as always, this information is for general purposes only, is not to be relied or construed as legal, business, or medical advice, and please consult a qualified practitioner as to your legal, business, or medical needs. Again, thank you for joining us in this two-part series. We look forward to seeing you next time on The Legal Edition.